Hello, in this video, we're going to talk about desired qualities of nurses. This particular portion was created specifically by some of the registered nursing professors here at Solano Community College, but I, as a counselor, am conveying that information to you. So hopefully you'll find it interesting, and hopefully this is going to work because I've recorded this about 10 times. But alas, let's move forward. So desired qualities of nurses. So nurses need to have strong communication skills, both verbal and written skills. The nurse is the ringleader. So as a nurse, you are going to be the liaison between the patient and the doctor. You're also going to be communicating with various other healthcare professionals in the hospital, the respiratory therapist, the dietitian. You are also the liaison between the patient and their families. So you want to make sure that you have strong communication skills. Um, Also, you need to have really good writing skills because you're going to be doing quite a bit of charting and documenting, and you need to be able to maintain accurate records. The other thing that goes along with communication skills is you need to also be able to read nonverbal cues from your patients, because a lot of times people maybe can't express verbally how they're feeling. So you need to be able to read body language. A nurse also needs to be nurturing, empathetic, and compassionate. I think that kind of goes without saying, but nonetheless, we need to emphasize that. So you can look at the nurse in the upper photo here. Just look at her face, the care and compassion that's on her face. You know how they say a picture's worth 1,000 words. So you can just see the connection that she's having with her patient. Um, you want to have really good bedside manner. So empathy is really important. My mom was a nurse for many years, and she said that that was the number one characteristic of a good nurse, is to be empathetic. Um, you need to be able to feel what your patients are feeling, and at such a deep level that you want to relieve that pain and that suffering. So that's really important. Nurses need to have an innate desire to care for others. And I think that you can tell that in a person if they're nurturing, empathetic, and compassionate. So extremely important there. So some of the other desired qualities are you want to have good organization, prioritization, problem solving, and ability to see the big picture. So if you see in this picture on the right, there's maybe like 4 or 5 different patients in the room there. And so in a hospital, you could be caring for as many as 5 patients at a time, perhaps more. So you need to be able to prioritize and know which patient needs your care most urgently. Um, and so in terms of like the big picture, they used to tell the story in the workshops of one of our registered nursing students who was so focused on a wound that one of the patients had that the student didn't notice that the patient had stopped breathing. So you have to really keep it's not really funny, you have to really keep the big picture in mind. And as a registered nurse, you're always interrupted and you're always dealing with the unpredictable. So being able to be organized and being a good problem solver is going to help you with that. Also, as part of the big picture, you're caring not only for the physical needs of the patients, but also their emotional needs as well, not only for them, but also for their families as well. So those are good qualities to have. Some other desired qualities are you want to have high ethical and moral standards. If you think about it, your patients that you're helping are in a very vulnerable state. They're not feeling well. And plus they're a lot of times wearing a hospital gown, right? Um, and so they're very vulnerable that way. And they're also people, when they don't feel well, they share very intimate details. And so it's very important that as a healthcare professional, you maintain the confidentiality of the patient. And also, it's important to maintain the patient's dignity. At all times, you want to make sure that they are, appropriately covered, and that, you speak very highly of them. Um, Also, in terms of ethics, if you think about it, how many other careers do you know of where it's legal to carry cocaine in your pocket? So nurses are entrusted with all different types of medication. And so you need to have high ethical standards so that the patients know that they're going to get that medication. Nurses also need to be very dependable and accountable. This is true even in our actual program, because they have a very strict policy on attendance, because the Board of Registered Nursing dictates that attendance policy. I believe that you're only able to have one clinical and one lecture absence per semester. So that's not very many absences that you can have. Um, and once you become a registered nurse, of course, the patients are counting on you to be there. And the nurse that you're relieving, he or she cannot leave the shift until you come on board. So it's very important that you are dependable and accountable, because if you're not there on time, then that nurse that you're supposed to relieve is going to be paid overtime. They used to say in the workshops that accountability is a major word in nursing. Having strong character is extremely important. Okay, next what we're going to look at, you have to be able to handle stressful situations. So as a nurse, you're going to have patients that are coding on you, patients that are dying. You're dealing with families in crisis. You're dealing with people that are, enduring a lot of pain and suffering. And I think in another video, I can't remember if I've said this, I've tried to do this so many different times, but you're dealing with people in their worst moments, their worst day, they're not feeling well. So that can be very stressful, but it's how wonderful it is for you as a nurse to help with that. So, in dealing with stressful situations, it's really important. I just want to make a plug for having adequate, appropriate self-care. As a helping professional, you want to make sure that you take care of yourself. And so start thinking about that. What are you doing to take care of yourself physically? Do you eat, do you have proper nutrition? Do you have proper exercise? What do you do to take care of yourself psychologically and mentally? Do you have a good support system around you with family and friends? What do you do to take care of yourself spiritually? Are you involved in a church or a temple? Or so just start thinking about that, because as a healthcare professional and a helping professional, you taking care of yourself is important so that you're able to take care of other people. So nurses need to have flexibility, they need to be flexible, and they need to have a sense of humor. So flexibility, again, because the profession is very unpredictable, you don't know what to expect on your shift. And also with flexibility, hospitals never close. So you are going to have the opportunity to work different shifts, nights, evenings, weekends. A lot of times as a new nurse, you're the ones working the evening shifts, the holidays. So being flexible is important. And one of the ways that you can deal with the stressful situations is by having a sense of humor. So you can see I put in a little picture here, the anatomy of a nurse. She's got eyes that have seen it all. She's got a warm heart, an empty stomach, a full bladder, mystery stains on her uniform, and a warped sense of humor. So yes, I think a sense of humor is extremely important as you go into this type of a profession. So I want to thank you for watching. Those are just some of the desired qualities that we gleaned, that we felt were important to share with you. So be thinking about that. And we wish you all the best success in your journey to become a registered nurse. And thank you so much for watching. Have a great day or evening, depending on when you're watching.